As a family physician, I'm seeing more and more patients who suffer from several chronic diseases. They represent a growing burden on the healthcare system. The Concerto Health Program offers interdisciplinary care and service pathways for the prevention and optimal management of chronic diseases at the primary care level. This is Mary. I'm her family physician. She's 45 years old, obese and sedentary, a smoker, and occasionally drinks alcohol. She'll tell us about her path through the current healthcare system and the incidents that could have been prevented if she had been treated by Concerto.
I saw my doctor last month. He said my blood pressure was normal, but I had to lose weight, exercise, stop smoking, and drink less alcohol. I should make an appointment to see him in 1 year. Right now I have headaches. I also managed to get an appointment with another doctor at the walk-in clinic. I can't get in to see my doctor for 6 months. My headaches have become unbearable. I finally decided to go to emergency, even though I didn't really want to.
A health classification table allows me to determine that Mary is a level 1 patient. Using the Concerto screening forms, I prescribe blood tests. Follow-up by a nurse after the blood test screening is planned automatically. The nurse uses a questionnaire designed specifically for Mary's health condition. She suspects high blood pressure and dyslipidemia. She goes ahead with a full physical exam. I confirm the diagnosis of high blood pressure and dyslipidemia. I prescribe the required medication. I categorize Mary as a level 2 patient. Based on Mary's concomitant pathologies, follow-up is scheduled, namely telephone follow-up, adapted instructional materials, guidelines to follow.
My doctor told me I have diabetes. I got an appointment at the hospital's diabetes center in 6 months. Then I came down with a cold. I could hardly breathe. I had to go to emergency again. I was in the hospital for 4 days. My husband and I were very worried, but I'm better now. I can't get in to see my doctor for 6 months.
As planned with Concerto, follow-up is done for the high blood pressure and dyslipidemia care pathways. Other screening tests reveal poorly controlled high blood sugar levels. The diabetes care pathway is therefore started. Mary is referred to the nutritionist on the interdisciplinary team at my medical clinic. Her health goals are reviewed with her and she is given new tools. During the screening tests, the nurse detects possible signs of pulmonary disease. Mary is referred to the program's respiratory therapist. The therapist suspects there might be chronic obstructive pulmonary disease. I see Mary in a consultation. I confirm the COPD diagnosis and prescribe the required medication. A personalized action plan is started. Mary is referred to the COPD clinic at the hospital to get the necessary instructional materials.
I'd never felt such pain in my chest. I called an ambulance. The emergency doctor told me that I'd had a heart attack, complicated by chronic heart and chronic renal failure. I was hospitalized for almost 10 days. This time I was scared.
With Concerto, I am aware of Mary's complications after telephone follow-up with the nurse. At a consultation, I confirm the diagnoses of chronic heart and chronic renal failure. I categorize Mary as a level 3 patient. The pharmacist at the clinic gets the medication profile from Mary's community pharmacy. He tells me about her assessment and his recommendations. An individualized interdisciplinary intervention plan is set up.
I'm already 52 years old. I've been having health problems for about 7 years now. I'm exhausted. I told my husband that I'd rather die than continue to suffer with all these drugs. He got very worried and took me to emergency. After spending 2 days on a stretcher, I was released. I'm on the waiting list to see a psychiatrist.
An altered mood is observed during telephone follow-up with the nurse, which is planned with Concerto. An appointment is quickly made with the social worker. A specific questionnaire makes it possible to conclude an episode of depression. I confirm the diagnosis of depression and review the medication. Mary is referred to the psychologist at the clinic. Mary's individualized interdisciplinary intervention plan is reviewed by the team, with Mary's collaboration.
I'm 62 years old now. I've been hospitalized every year. The last time it was for 1 month for respiratory and heart problems. I'm exhausted, but I have to keep my spirits up.
Mary is now categorized as a level 4 patient. A nurse case manager is assigned to Mary. Contact with her is on a weekly basis or as needed. An occupational therapist from the clinic is added to the team. A tele-home care protocol is set up. Every day, Mary enters information on a small device connected to the clinic's information system. Mary feels safe. She no longer has to leave home except for routine exams, and a nurse is always available at the other end of the line. If needed, she can always consult with me. Instead of organizing care according to each pathology, the Concerto program makes it possible to prevent and treat multiple pathologies, categorize patients according to their level of health, personalize services based on the presence of one or more pathologies in one patient, speed up patient management by standardizing professional practices, coordinate care better, produce results rapidly. The professionals greatly appreciate the sharing of expertise and feedback on the clinical results and the impact of new ways of doing things, and the patients are very satisfied.